Hi, this is Brian Schiff with Functionally Fit. In this column, I'm going to show you an exercise called the standing pigeon stretch that can be used to improve hip range of motion or hip mobility, if you will, and also to kind of stretch the piriformis and gluteal musculature. There's a lot of good hip mobility exercises that you can choose for your clients. This one is effective, but also comes with a caveat that we do not want to force hip range of motion or force end range to a joint that maybe isn't so receptive to it. So you're going to want to kind of coach your clients up on the type of end feel or sensation they feel while doing this, because we want them to feel a soft tissue stretch, not a bony roadblock, a pinching type sensation, or certainly not discomfort in the front of the hip. So for this particular instance, I'll use this 24-inch box. We'll position the leg up here. And typically, your hip's going to be slightly offset and the knee flexed to a comfortable level. And then as the client is standing here upright, we'll instruct them to lean forward until they start to feel a comfortable stretch. And they may want to hold that for, at least probably 5 or 10 seconds. Some people prefer a longer, more sustained stretch. I think, ultimately you want to accomplish a comfortable stretch. If you're thinking more on the mobility lines versus pure static stretching, then you may have them work into the hip, pause for a few seconds, and kind of work out. And then you may have them even work at slightly different trunk angles to feel different parts of the stretch throughout the soft tissue, and just to kind of work on mobilizing or improving mobility in that range of motion. So again, as I mentioned, this will work on external rotation of the hip. It will work on stretching that posterior side, glute piriformis type musculature. But if your client feels any pinching, groin type pain, or just hard tissue resistance, that would be a red flag. You'd want to back off the stretch, because depending on the bony architecture in the hip, it may not be indicated for them. So again, this is just one example. This can be regressed and done in more of a static sitting position as well, where you might position the client here and then have them gently pigeon like this. So again, good way to work on hip mobility, but be cautious, make sure it is truly indicated for your client.